Remote access, improved technology, and relaxed regulations all play into the fast growth of telemedicine. Our presenters, Victoria Summers and Rajesh Unikrishnan, are here today to discuss how the landscape is changing and take a look at specific pharma use cases that help define the value of telemedicine. Victoria, Rajesh, welcome, and thank you for covering such a timely topic. I'll hand it over to both of you.
Thank you, Emma. Thank you everyone for participating and joining us today. Victoria and I are looking forward to sharing some of our thoughts. If you go to the next slide, please. I'm gonna just great, thank you, Victoria. So it looks like from the poll, you know, 2/3 of you have had some access to telehealth, either I'm assuming some sort of either live video version or asynchronous texting or some other version of access to telehealth to have an encounter with your clinician. This is remarkable. About 3 years ago, this was maybe 2018, Victoria reached out to me and said, "Hey, we should write an article about telehealth." And I said, "Well, you know, it's a 1% mindshare problem. You know, is it that significant?" And then, you know, lo and behold, Victoria was more than right. As you all have experienced, and what we have seen is there has been an explosion during the pandemic period. Telehealth went from, you know, sub 1% of the overall outpatient visits to as high as 30-40% during the peak of the pandemic, and still kind of retaining a significant percentage of visits. Just in terms of sheer numbers, right? It's gone from about 30x more claims today are being associated with remote telehealth, which is, again, incredible. Not only in the US, but as we look globally in Europe and the rest of the world, about telemedicine usage across physicians, it's definitely greater than a majority of the physicians are using telemedicine, and those that use telemedicine, a good 25 to 30% of their visits with their patients are remote. Again, this is incredible to see such a huge behavior change happening in such a short span of time. And when we look at, you know, what is the service model that has been supporting this tremendous growth here, there's largely 3 different types of service models that are prevalent. About, you know, today, about 90% of the telemedicine visits are fulfilled by essentially brick and mortar physicians that have a relationship with a patient, engaging with them digitally, using consumer out-of-the-box tools like Zoom or WhatsApp. But there, about 10% or so of the telemedicine visits are being serviced by these newer models. Companies like Babylon in the UK and Europe, and American Well in the US, and globally, essentially are technology platform players with service providers or doctors supporting practicing medicine on these platforms, either on a part-time basis, essentially servicing patients outside their regular physician that they see. And an interesting group here is also about 5% of the telemedicine services provided by what we're calling digital practices. For example, Teleclinic in Germany or PlushCare in the US, who are vertically integrated, digital-only medical groups. They have a headquarters, but all their physicians are 100% employed by these companies. And these physicians practice medicine only digitally, only for this group. And as we look at the amount of investment that has flown, over $7 billion in just Q1 of this year, which is almost equivalent to the entire investment in the year 2019, that's really driving the growth of this modality, given the proof points that has come during the pandemic. Now, beyond the numbers, I'd like to take us one click deeper into what exactly is the reality on the ground. And Victoria has been doing a fair amount of research with the actual end users. So Victoria can maybe share with us some insights there.
Thanks, Rajesh. We have done a lot of research into what the experience has been like using telehealth, you know, over the past, 6 to 9 months, and conducted research with, patients and providers and payer groups, both in the US as well as in across Europe. And Also across a variety of different therapy areas. And so we've tried to really kind of get an understanding of what are some of the common benefits that different groups are seeing in telehealth, and what are some of the challenges. One of the things that's kind of the high level headline on the benefits and the challenges is that the benefits seem to be highly aligned with the value that telehealth is providing that extends beyond a particular value during COVID or a quarantine situation. There's, a great amount of value and quality and improved care that's being delivered through telehealth that will continue to spur its growth. What we see in the challenges is a variety of challenges you would expect with any kind of new offering, where there's maybe some concerns about exactly how to use it. There may be some kind of, clunky technology experiences, but all of the challenges seem to be things that will eventually probably, go away as the channel matures. So just to walk you through some of the insights that we've gained across all users and across the globe, patients are reporting one not very surprising aspect is that they really appreciate the convenience of telehealth. It allows them to stay in their homes. It allows them to not have a lot of wait time or take time off work. And so they feel that they can get a little bit, maybe more regular care. One thing that was a little interesting is that they really believed they were getting, better follow-up, and they were keeping some of those follow-up appointments. Whereas before, if they had to go into the office, even before COVID, they might deprioritize some of those follow-up visits if they felt that they just maybe didn't need them, or they felt like they didn't really have any questions or concerns. The ability to follow up quickly with a physician through telehealth was seen as being very advantageous to their care, and really kind of getting some more of that access to the physicians that they hadn't had before. Patient challenges included things like connectivity. There are certainly still areas of the US and rural areas that don't have broadband connectivity. There's also some issues in certain other countries. There's also some concerns with more elderly telehealth users that maybe they just weren't understanding the telehealth interface as well, or struggling to kind of connect that way. But again, those types of challenges seem to be going away. Providers also found a lot of value. They really like the convenience, but also being able to provide the continuity of care, being able to see their patients and continue to see their patients regardless of, a quarantine situation or a concern about exposure. But one surprising thing with providers that we learned both in the US and ex-US is that there are sometimes elements of an in-person visit that aren't necessarily critical, but are expected. So a physician will go into an exam room and the patient will be sitting on the exam table. An oncologist, related a story that they feel kind of that they have an obligation to conduct the physical exam, even if there's not a lot of need for it. So the way that the telehealth can kind of spur additional conversation, additional educational opportunities, more time just talking one-on-one during the virtual consult, and not having to do some of those exam room or more physical exams that would be expected in an in-person visit was seen as being a benefit. We're also hearing from physicians they're not really sure where reimbursement's going in the U.S. There's certainly a lot of early indicators that the parity of payment that spurred a lot of the telehealth growth will continue, but not sure about where that will be. There's also something that we'll talk about a little bit later as it relates to what pharma can do to help the situation in this need for training around webside manner. The physicians, use this term to describe how to create empathy and create connection over a virtual consult platform that they feel ill-prepared to do that. So, it's a great question here that's popping up in the polling. At what stage in the patient journey does telehealth have the greatest opportunity and really provide the greatest quality and access to care? So encourage you to respond to that. I'll just mention one thing about payers. We do find that payers are really kind of starting to see some benefits to telehealth. They're starting to see greater efficiencies. They're starting to see, avoidance of acute care admissions because the patients are able to get more immediate care delivered in their home over telehealth. There are some things that payers would like to see around accountability and maybe a little bit more, greater understanding around the regulations. But overall, they're starting to see a lot of benefits themselves. Excellent. So I see that there was a great recognition for the improvement of follow-up care on telehealth. We certainly saw that across all of the disease categories that we talked with, both patients and physicians and payers, all saw a lot of value with follow-up care for telehealth. It's great. Thank you.
Great. So the question that often comes up is, where is this going to go? And our projection is that from all the work that we've done is 20+% of visits are expected to be virtual over the next 2 to 3 years. And that's again, a significant growth from less than 1% just about 18 months ago. And when we look at the data across specialties, it's quite varied from, psychiatry being an early adopter of telehealth, and it's always been favorable, to all the way on the other hand, dermatology and OB. And it is based on a few factors around how virtualizable is the workflow of care, the exact activities that happen during an encounter. What is the consumer or the patient's willingness to adopt a televisit for a particular part of that treatment journey? And what is the healthcare professional's favorability in terms of a data-driven or a technology-driven approach to managing care? For example, we found that endos are very comfortable with a data-driven approach to care, and they're quite frankly available and open to telemedicine right from diagnosis all the way to treatment start and follow-up. On the flip side, dermatologists, very open to telemedicine on the front end of screening and diagnosis, but they just lack the tools. The fidelity of the smartphone camera is not sufficient for them to actually make some diagnosis decisions. So we expect that the intent for shifting visits towards remote is there because of some of the factors Victoria mentioned, but there are some challenges that needs to be overcome, which we believe is a natural course of technology as it improves. When we look at what service models are going to win in this future state, we forecast that of the 20+% or 30% or so of visits that are expected to be virtual, about a significant majority of it is going to be in what we're calling the hybrid model, where you have point service solution providers, as well as the brick and mortar physicians adopting telemedicine to do the bulk of the virtual care visits. That's the service model that's going to be dominant. A lot of benefits in that, improved access, convenience, and so on. But there are some challenges that we are also seeing in terms of the ability to diagnose effectively, the ability to start a treatment, and so on. But what's interesting is the other model, the digital clinics that we talked about earlier. Several of them are really bulking up to go beyond being just an acute event or a telemedicine encounter solution service provider. They're adding remote monitoring, they're adding second opinions, they're adding referral networks. So they're truly starting to become an end-to-end integrated digital model, especially in certain areas like chronic diseases like cardiovascular, respiratory, mental health. And the benefits of this model really is around taking full ownership of the patient in terms of outcomes and cost savings, but also driving improved outcomes through better control of the referral network and deciding what kind of therapeutics are going to be prescribed within this group. So really starting to act like a close network and something to be closely watching out for. So the question then is what is pharma's role in this future state? Victoria has some thoughts here based on our work with companies.
Yes, it's interesting that as we've been exploring telehealth, we've also been, having a lot of conversations with a variety of different, pharma companies across the globe. And there really seems to be about kind of 6 core areas where there's some challenges that are uniquely designed for pharma to help solve as they support patients and providers. Just starting with patients, there's 3 kind of core needs that patients are struggling with. The first one is just navigating the telehealth landscape, understanding when should they be using telehealth, when how can they get access to it, what's really beneficial, having these kind of ways and education, maybe connection points to telehealth that certain brands have put on their websites or connected patients to. That seems to be kind of a big piece and a big interest of patients. Another area is patient education materials. There's so much around, the ability of patients to be able to do so much digitally and be able to understand more, so that when they go into the physician, they're more, educated and having a better conversation, coming from a more informed place. Telehealth is seen as provided by the pharma companies, is seen as being a great way to connect patients to a physician, that they don't need to, necessarily get a diagnosis or a prescription, but they can just learn more and talk more with that physician about the kinds of questions they might have, and be able to get more information, so that when they go in person and talk to their doctor, they're in a more informed place. And lastly, medication continuity. It was interesting in the poll to see so many of you note that follow-up is a great place for telehealth, because we're certainly seeing that in patient support programs. Thinking about connecting, patients that are in patient support and adherence programs, and supporting them with a telehealth option, so that they can make sure that they're connected in with a physician that could help them get, navigate the process of getting a refill is critically important, especially now where we have so much disruption in people's jobs and people's where they're living, and may have a disconnect from the physician that they had normally seen. On the physician side, they're asking pharma for a lot of things. One of the first thing they're asking for is digital information that they can embed into their telehealth workflow, so that when they have these virtual consults, they can have materials they can share easily with patients. Something that they could pull up and walk a patient through, like a visual or a video that they could send afterwards that provides some additional information. We're seeing a lot of really innovative tools that are being added into that workflow, that are providing a great amount of value for physicians and helping them with that website manner, if you will. Virtual care best practices are another training area where physicians are, interested in hearing from pharma how they could be better, how can they, really connect with patients through virtual consults, how should they think about organizing virtual consults as part of their practice, and really interested in hearing how they could improve their experiences for their patients. And then lastly, remote lab service integration. One of the things that we found, and the reason that right now the follow-up care is a big place for telehealth, and will probably continue to be so, but as lab services and in-home diagnostics and mobile diagnostics become more prevalent, become more connected in with this telehealth workflow, we'll see more opportunities for physicians to be able to connect to patients earlier in that diagnosis and treatment pathway. That's certainly happening now, but we can see that will even increase as we start to see more of these lab services, be engaged.
So what is our perspective on what should be pharma's telehealth strategy? We agree that follow-up care is a natural fit for where telehealth may sit today. But we also believe that there's clearly an opportunity for telehealth to be an accelerator for treatment overall. One of the studies that we did when we looked at a test and control group of patients who were being considered for a biologic after an acute care event, we found that the test group, which actually had access to telemedicine, were treated with a biologic 23 days faster than the control group, and at a rate of 77% compared to 40% of the control group. So much higher treatment rate and much faster treatment when there's appropriate access, follow-up, and ability for a dialogue between a patient and a physician more frequently than otherwise. So while we believe that it is better access and better quality of access actually leads to faster and appropriate treatment for patients. So therefore, we believe that telehealth has sort of two pillars of pharma strategy. It's a new channel for reaching, activating, and providing patients access to care. And it's enabling, the second pillar is enabling how doctors and provider health systems and hospitals do business in terms of supporting their patients, enabling that new way of how medicine is going to be practiced in the future. And we believe that pharma has a role in both of these pillars. However, to be successful here, there are some important factors that we have observed working with companies. Creating a new channel for helping patients navigate and reach access to care requires really re-looking at the patient journey. It is not appropriate to take a brick and mortar or a physical patient journey and just digitize it and expect to have greater access to patients to reach care. And we for example, some of the assets that we use today in supporting patients, like a doctor-patient dialogue checklist, it's static, it's PDFs. Whereas in a digital environment, you can really start taking advantage of things like adaptive interviewing, create natural language history of a patient's concern that becomes a lot more easier narrative for a patient to present their case to a doctor. So there's real power in thinking about the digital channel and what it can actually provide for pharma. The next thing is it's not appropriate for technology. For example, many companies have sort of taken the idea of talk to a doctor and put that sort of call to action on their website. The challenge is a pure technology alone intervention doesn't necessarily always create the best likelihood of conversion of the patient taking the action. You need a technology plus a human touch. And then finally, not unlike any other e-commerce channel, optimizing the data of both anonymous and patient identified data to optimize both the engagement on the front door of the channel, as well as orchestrating the patient through subsequent touch points, either be the sales force or the customer service rep. So really thinking about this journey and optimizing that using a data-driven approach is really what's shown to be successful versus those that have been challenged with trying to take advantage of the strategy. Similarly, on the provider side, we find that it really comes down to having solid relationships with organized buyers. So in this case, hospital systems. In many cases, it could be the physician who champions a particular tactic. For example, providing a click through to a copay card option in the EHR. But in many cases, it may be the chief medical officer of that provider system that needs to buy in to the idea of providing disease education material digitally to their patients. So having effective relationships is very important, and how to interact with these buyers. Virtually everything in healthcare today is done through the EHR or EHR enabled systems. So the teams that work on these tactics from pharma, engage with provider systems, really need to bring in native health IT experiences to create lightweight tactics that provider systems can actually implement and deploy to their patients effectively without getting caught up in long security audit and compliance issues on the provider side. And then finally, you don't have to go it alone. Yes, telehealth providers are not necessarily creating features and solutions to enable pharma, but if pharma can identify a demand or a use case or a need that a provider has, test out or pilot that particular feature or solution, telehealth providers are more than happy to actually take that and carry that on their platform to deploy. So there is openness to partnership, and I think that is something that those relationships are critical to build with the partners. So in a nutshell, what do we think is our strategy or recommendations for pharma? Go ahead, Victoria.
Yeah, no, absolutely. I was just giving the poll a little bit of time here for people to respond, like what your company is doing to support telehealth. We really feel that there's 4 things that Pharma needs to do. First and foremost, just committing to a telehealth strategy, really thinking about where telehealth is going to make an impact for your patients, and then starting to, kind of align your practices and your decisions around that strategy. And thinking about the impact across the patient journey. Where does telehealth engage? Where is the best place to help solve a patient problem by using telehealth? And this third piece is really important, and one that we're seeing companies really struggle with, this idea of this experience design and the promotion. As Vijesh mentioned, we did see a lot of brands that were putting a click here to talk to a doctor as a call to action on their television spot or on their website, and there was some mixed experiences with those, and a lot of times that mixed experience was because there wasn't a real problem that they were solving from the patient experience side of things. And also a lack of awareness. when you're having a digital solution like this, it's important to really promote it strongly and consistently through all the channels. And sometimes that happened and sometimes that didn't. And lastly, integrating data and analytics, making sure that, since this is a digital access, tool, you're able to understand a lot more about what's working, what patients are valuing about different aspects of that solution. So it's important to be able to have that expertise in place. So very good. It looks like a lot of people are partnering with telehealth providers, which is smart. It's great.
Great. I think we are at the end of our prepared content, and we can start taking some questions.
Perfect. We have a couple of questions that came in. Rajesh, the first one for you. So regarding the scope of telehealth, do you consider COVID vaccine centers and their online appointment rating rankings also a telehealth connection?
Can you repeat that question again, Emma?
Sure. Do you consider COVID vaccine centers and their online appointment rating rankings as a telehealth connection?
Yeah, it's a good question. So COVID appointment centers, I'm not sure which part of the world that question is coming from. I can relate to certain things from where I'm based out of. Can vary quite widely from the healthcare, from a hospital to a retail pharmacy to a state provided vaccination camp. We believe, and actually my experience has been, and our experience has been, that telehealth, the point that we said earlier, is going to be a hybrid model, where the activation of that patient to reach them, activate them, tell them that there's a vaccination appointment available. In fact, even maybe a pre-vaccination appointment nurse call or a concierge nurse call to get that patient comfortable about seeking that next step of treatment may all be done virtually, which is actually does happening. And then you facilitate that actual vaccination itself in a center or location that's convenient to the patient. So we consider that as this part of this hybrid model, where it's almost an omni-channel experience between the physical and virtual.
Perfect. Victoria, we have a question for you. What advice do you have for the pharma companies with in-field sales reps with regard to the increase in telemedicine or developing a telehealth strategy?
No, it's a really great question. We're certainly seeing a lot of physicians responding that they, didn't have a lot of opportunities to see reps in person, and that gave them some more flexibility to stay home and deliver telehealth. And they kind of liked being able to have the kind of on-demand relationship with their reps. So, we are seeing, a growing interest among physicians that are delivering care over telehealth to get additional training, to have additional materials, to have reps be able to provide some more, kind of more multimedia resources and tools. So when you think about a telehealth strategy and how you'll start to integrate that with the field force, it's important to recognize that the telehealth engagement between the physician and the patient is something that is new, and that physicians are looking to pharma, looking to their pharma reps to help them with that. So there's a lot of opportunities to have your field force be part of your deployment to physicians for some of these patient tools and materials and physician training.
Perfect. And Rajesh, with regard to telehealth strategy, will managed care support the expanded pillars that you noted today?
That's a good question. We in our research with payers and managed care, it has become clear for them that while they've had to provide parity coverage for telehealth during this emergency pandemic situation, the good news about that is, for the longest time, they just didn't have enough experience with telehealth. There was just not enough data to know what population is going to benefit, what population is not, for them to actually make a coverage policy decision around telehealth. So they just dug their heel and did not pay for it, or passed on most of the cost to the patients. But now, with increasing amount of data and actual experience, they're starting to see some real benefit of providing that access to many, many patient cohorts. They're seeing reduced hospitalizations, they're seeing reduced exacerbations of patients with chronic care. So we expect to see managed care really taking a position of more favorability than otherwise. And given that, I think we believe that the two pillars will hold. There will be some policy coverage nuances, but we don't believe that it's going to be detrimental to patient access, especially considering government and policymakers' enthusiasm about continuing this trend.